the world of healthcare is changing rapidly. Telemedicine, once a futuristic concept, has become a lifeline for many. Patients now connect with doctors through video calls, apps, and remote monitoring devices. This shift offers convenience and accessibility, but it comes with a unique set of challenges. Current regulations are struggling to keep pace with this technological evolution. This lag creates uncertainty for both healthcare providers and patients. One of the most significant hurdles is the patchwork of state laws governing telemedicine. Each state has its own set of rules, leading to confusion and inconsistencies. This confusion can hinder the seamless delivery of care across state lines. Imagine a patient traveling for work and needing to see their doctor urgently. They might be unable to do so due to conflicting regulations. Another major obstacle is the issue of medical licensure. Doctors are licensed to practice in specific states. Telemedicine, by its very nature, can transcend geographical boundaries. This creates a conflict between the scope of practice and the location of the patient. Should a doctor in California be allowed to treat a patient in Florida remotely? The answer remains unclear, creating a barrier to widespread telemedicine adoption. Additionally, the way insurance companies approach telemedicine is inconsistent and often confusing. Medicare and Medicaid, the government-funded insurance programs, have fluctuating rules regarding reimbursement for telemedicine services. This uncertainty makes it difficult for healthcare providers to plan and invest in telemedicine infrastructure. The lack of uniform guidelines for telemedicine across states has created a complex web of regulations. This complexity can deter healthcare providers from fully embracing telemedicine. The fear of inadvertently violating a state law is a significant concern. For example, a doctor licensed in New York might be hesitant to provide a telemedicine consultation to a patient in Texas, unsure of the legal implications. The patchwork of state regulations not only affects healthcare providers, it also impacts patients' access to care. Patients in rural areas or those with limited mobility often benefit the most from telemedicine. However, these patients might find themselves in a situation where their access is restricted due to their state's regulations. This situation exacerbates existing healthcare disparities and limits access to specialized care. Another layer of complexity arises from the varying requirements for establishing a doctor-patient relationship in different states. Some states mandate an in-person visit before telemedicine services can be provided. This requirement can be impractical and burdensome for both patients and healthcare providers. It also undermines the very purpose of telemedicine, which is to provide convenient and accessible healthcare. The debate over interstate licensure further complicates matters. Proponents argue that a national licensing system would streamline telemedicine and expand access to care. Opponents, however, raise concerns about maintaining quality of care and ensuring accountability across state lines. This debate highlights the need for a balanced approach that considers both patient access and the integrity of medical practice. The transition to a more digital healthcare experience brings with it inherent privacy and security concerns. When patient data travels through the internet, it becomes susceptible to breaches and unauthorized access. This vulnerability necessitates robust security measures to protect sensitive health information. Healthcare providers utilizing telemedicine platforms must adhere to the Health Insurance Portability and Accountability Act, or HIPAA. HIPAA sets the standard for protecting sensitive patient data. However, implementing these standards in a telemedicine context can be complex and requires ongoing vigilance. Encryption, secure messaging systems, and regular security audits are crucial components of a HIPAA-compliant telemedicine platform. Patients also play a vital role in maintaining privacy during telemedicine consultations. They should ensure they are using a secure internet connection and be mindful of their surroundings. Sharing personal health information in a public setting can compromise privacy. Open communication between patients and providers about privacy concerns is paramount. The rapid adoption of telemedicine during the COVID-19 pandemic raised concerns about the adequacy of existing privacy and security measures. The relaxation of certain regulations to expand access to care during the emergency highlighted the need for a re-evaluation of long-term data security strategies in the context of telemedicine. Amidst the evolving landscape of telemedicine regulations, interprofessional e-consults offer a promising solution. E-consults allow primary care physicians to connect with specialists electronically. This connection facilitates the exchange of patient information and expert opinions without the need for a traditional referral or a face-to-face visit. Unlike some telemedicine modalities, e-consults are generally not subject to the same level of regulatory scrutiny. This distinction stems from the fact that e-consults occur within the existing framework of the healthcare system. The primary care physician maintains the primary doctor-patient relationship, and the specialist acts as a consultant. This model sidesteps many of the legal and logistical challenges associated with direct-to-patient telemedicine. Furthermore, e-consults offer a stable reimbursement pathway. Established CPT codes for e-consults ensure that providers are compensated for their expertise. This predictability is crucial in an environment where reimbursement for telemedicine services can be unpredictable. This stability makes e-consults an attractive option for both primary care physicians and specialists. E-consults represent a practical and effective way to enhance patient care while navigating the complexities of telemedicine regulations. By leveraging technology to facilitate communication between healthcare providers, e-consults improve access to specialized knowledge, reduce healthcare costs, and ultimately lead to better patient outcomes.